CBC's Health Minister Adrian Dix joins me now. Minister, nice to see you again.
Good morning, Rosemary.
Your government, I think the last time we talked, in fact, was when you were dealing with kind of a similar issue. Lots of Americans trying to buy Ozempic from BC, not just for diabetes, but for weight loss. Do you have concerns about what this deal could mean for Canadians and for your province in particular?
Well, in the Ozempic case, we took action. We passed new regulations that essentially stopped 99% of those sales of Ozempic, and it's a good thing we did because, as you know, there's a worldwide shortage of Ozempic now. We would be in much more serious circumstances. British Columbians would be if we hadn't done that. In this case, this is at a different scale altogether. What we're talking about is the importation of billions of dollars under the Florida scheme that has been approved by the FDA. Billions of dollars of drugs. They're drugs produced by big multinational companies such as Pfizer and Novartis and Bristol Myers, and they're proposing to divert essentially from Canadian supply billions of dollars of drugs to Florida. 7 other states have passed similar laws and are at different stages of approval with the FDA. So it would be a significant issue if this were to allow to happen, but I don't think it will.
Yeah, okay, so let's talk about that. In 2019, there were attempts to do this as well, and it was blocked. The Canadian government blocked it at the time. In a statement from Health Canada just on Friday, they said that they will make sure that people understand their obligations under Canadian regulations and that people should not be, in theory, allowing drugs to be sold to another person for consumption or use outside of Canada unless they hold the license has reasonable grounds to understand that it would not worsen a shortage. Is that statement from Friday reassuring enough to you?
Well, it's reassuring. This is because it involves distributors and not pharmacies. This is a federal matter. Federal government has the power to address this. This would clearly, under any circumstance, we're talking about a request for 17 drugs here. Florida says they would save $185 million, which tells you how high drug prices are in the United States just on these 17 drugs. So this would clearly cause a drug shortage. The federal government has that authority under food and drug regulations to take action on that. And so them saying that is reassuring. And of course, we'll be ensuring and talking to them about following through on their legal obligation to protect Canadians. But there's 2 other reasons. One, the pharmaceutical companies are against it too. So I don't know how this supply would come if it was additional to the current Canadian needs. This is effectively a raid on Canada's drug supply. And thirdly, there is a company involved here, a Canadian company involved. You see it in the Florida application called MethaPharm, which is a Brantford, Ontario company. They're a specialty pharmaceutical company. They don't currently provide any of these 17 drugs, I don't believe, looking at their information, their public information. But they would have to find a way to obtain these drugs. They don't produce them, and then send them to the United States, and they would have to show they're under a legal obligation to show it wouldn't cause a shortage in Canada. So for all of these reasons, I think this is more about very strange U.S. politics than it is about a serious proposal that will go forward.
Well, let me ask you about that, because it does seem to highlight the problems that the United States has in providing accessible and not expensive drugs to Americans. Is that what you think this is about, as opposed to the system that exists in this country?
Well, what I'd say the United States politicians, I suppose, is all of the things we do in Canada, all of the things they do in the UK and France to deal with this issue, they could do in the United States. So it's a political failure, right? Now, the motivations of people are different here. The Republican politicians have consistently opposed prescription drug reform. They're the main reason why it hasn't happened in the United States. They've consistently opposed it over time. Now, this proposal is a proposal supported by President Trump a couple of years ago, supported by Florida Governor Ron DeSantis. This is a proposal to essentially give up sovereignty over the cost of prescription drugs in order to get cheaper drugs, because they don't want to do the reforms in the United States. For the Democratic politicians who do, I think, want to reform some of these areas of prescription drugs in the United States, and they've taken some action recently, I think, on insulin and some drugs used by people under their Medicare program, they don't want to give this opportunity, I suppose, to the Republican politicians. They'd rather leave it, I guess, to Canada to deal with this issue. And I think The federal government has indicated that it will, and will, of course, be working hard to make sure that they understand what's at stake.
So just finally, I guess, so you would expect that Ottawa would block any attempt from this from happening, given what they've done in the past. And then what would you say to Canadians who see these kinds of headlines and are concerned?
Well, I would say to Canadians that we need to take action when these things come. We can't just sit idly by. That's what we did in British Columbia, and that's what they need to do in Ottawa. And I think it will be interesting to see what this company MethaPharm says about its ideas here, but I don't think what's being proposed here is realistic. So I'd say that. To the U.S., I'd say reform prescription drug policy and do it in the United States if you want to do it.
Yeah. Minister Adrian Dix, always good to speak with you, and glad you made the time again today, sir.
Hey, right on. Take care, Rosemary.
Thanks.